Good day, learners! I am Teacher Fitz and welcome to another edition of your lesson in science for grade 9. In this lesson, we shall focus on how lifestyle affects the respiratory and circulatory systems. More specifically, we aim to attain the following objectives. Let's begin by measuring your pulse rate. Take your seat and lay down one of your arms on the table. Feel the pulse in your wrist using the index and middle fingers of your other hand. Count and record the number of pulses you have in 1 minute. This time, let's measure your breathing rate. Breathe in and out. Notice your chest and belly moving as you feel the soft air passing through your nose. Listen to the quiet sound of breathing in and out. Imagine the air moving from the nose into the throat, through the air tubes, and into the air sacs. Now, bring out the watch and find out how many breaths you normally take within 1 minute while you are seated. Wow, you just have measured your pulse and respiratory rates. What were your measurements? Do you think they are normal? Your pulse rate reflects the number of times your heart beats in a minute, while your respiratory rate tells you how many breaths per minute you take. These two measures are easily observable and are used to help assess your general wellness. Did you know that the normal pulse rate for an average person at rest is between 60 to 100 beats per minute? Did you also know that the average normal respiratory rate for an adolescent is from 12 to 16 breaths per minute? How does the values you have measured compare to these normal average values? Take note that the normal measurements that I have stated are true only when you are resting. When you work or do exercises, these rates will change. However, some people may have abnormal pulse and respiratory rates. This can be due to some unhealthy habits or even due to some existing diseases. There are many diseases that can affect our respiratory system. These include lung cancer, bronchitis, pneumonia, asthma, and emphysema. Meanwhile, diseases that may affect the circulatory system include coronary heart disease, hypertension, arteriosclerosis, thrombosis, anemia, and leukemia or blood cancer. Do you know any other diseases of the respiratory system? How about the circulatory system? The best way to prevent diseases in the respiratory and circulatory system is to make sure that you have a healthy lifestyle, which includes having a balanced diet, doing regular exercises, having adequate rest, maintaining proper hygiene, and avoiding vices such as cigarette smoking and alcohol drinking. Cigarette smoking harms nearly every organ in our body, causing many illnesses and affecting health in general. The negative effects of smoking in the circulatory system include increased heart rate and blood pressure, coronary heart disease, arteriosclerosis, and vascular diseases. The respiratory diseases caused by smoking are chronic bronchitis, emphysema, asthma, cough, colds, tuberculosis, lung cancer, and other respiratory infections. Alcohol consumption can also cause a temporary increase in heart rate and blood pressure. In the long term, alcohol abuse may lead to ongoing increased heart rate, high blood pressure, weakened heart muscle, and irregular heartbeat. Alcohol abuse may also decrease the body's ability to fight off infections and increase the risk of bacteria spreading into the trachea and lungs. Aside from having healthy habits and kicking off vices, it is also important to manage your stress levels. Finally, regular health checkups and physical screening also help in the early detection of circulatory and respiratory diseases, which may lead to its subsequent earlier treatment and management. Wow, were you able to get all of that? Let's check out if you have understood what we have talked about so far. I'm going to identify some diseases and then you classify them as either a disease of the respiratory system or of the circulatory system. Are you ready? Let's begin. Number 1, asthma. Number 2, anemia. Number 3, leukemia. Number 4, emphysema. Number 5, pneumonia. That's it. Now let's check if your answers are correct. Here are the answers. Did you get everything correctly? Good job! Now that you know the significance of your lifestyle to your good health, it's time to share it with your fellow teenagers. Think of 3 tips that you can share with your fellow teenagers on how they can keep their respiratory and circulatory systems healthy. Write this down and you may even share it on your social media account. Done? Great job! Currently, the world is in the midst of fighting a pandemic in the form of COVID-19. It is a disease caused by SARS-CoV-2, a coronavirus that can trigger a respiratory tract infection which ranges from mild to deadly. Infections can affect the upper respiratory tract, like your sinuses, nose, and throat, or the lower respiratory tract, like your trachea and lungs. Moreover, it spreads in the same way other coronaviruses do, which is through mainly person-to-person contact. Aside from maintaining healthy lifestyles, everybody can also do something to help fight this disease. In your own way, what can you do to help prevent the spread of COVID-19? Can you please name at least 3? If you mentioned wearing face masks, maintaining physical distancing, washing your hands, and staying at home, good job, you are on the right track. Keep on practicing these different health protocols. Remember that these protocols protect not only you, but also the people around you. Before we end, let's sum up what we have learned this time. In closing, always remember that our good lifestyle is the heart of our good health. Until our next lesson, bye!